Good evening. My name is Bridgette Baker, and I'll be your webinar producer for this evening's event. I am pleased to introduce the National Coalition of 100 Black Women, Inc.'s National President, Elizabeth A. Jones.
Good evening. It is my pleasure to bring greetings on behalf of the National Directorate and members that comprise the National Coalition of 100 Black Women, Incorporated. NCBW is a 40-year-old advocacy organization comprised of activist women and 62 chapters in 26 states and the District of Columbia. Our mission is to advocate on behalf of Black women and girls to promote leadership development and gender equity in the areas of health, education, and economic empowerment. Thank you for tuning in to NCBW COVID-19 Public Education Series webinar. This evening, we will explore the myths and facts of where we are in the pandemic. Thank you to our sponsor, the Department of Health and Human Services, and our partners, the Black Coalition Against COVID, the Black Women's Agenda, Walgreens, and We Can Do This for making tonight's webinar possible. Now it is my pleasure to introduce NCBW's National Vice President of Programs, Ms. Minnie Miller. She has served NCBW and our communities for over 25 years. National First Vice President, Minnie Miller.
Thank you, Madam National President Jones. It is my pleasure to introduce our facilitator for the National Coalition of 100 Black Women, Incorporated COVID-19 Public Education Series, Dr. Reed Tuckson. Dr. Tuckson is a physician who has, among many leadership opportunities, served as the Commissioner of Public Health for Washington, D.C., and president of the Charles R. Drew University of Medicine and Science, one of the 4 historically Black academic medical centers. He is also a co-founder of the Black Coalition Against COVID, Dr. Tuckson. Immediately following the poll, How Much Do You Know? You will hear from Dr. Reed Tuckson.
All right, and good evening, everyone. So we want to test how much do we actually know. So right about now, you should see the audience poll popping up on your screen. You'll see it either directly in front of you or it may be flashing at the bottom of your Zoom toolbar. We do encourage all of our audience to participate and answer the question for the myth number 1, which is the ingredients in COVID-19 vaccines are dangerous. Is it yes or no? And we'll give you about 10 more seconds to respond. We do see quite a bit of the audience responding, so we appreciate your participation. We'll give you just a few more seconds before we move on to the next question. All right, just about everyone has responded. Let's move on to the next one. So in just a moment, you should see the next myth forming up on the screen. Okay, there it is. So the next myth popping up is the natural immunity I get from being sick with COVID-19 is better than the immunity I get from COVID-19 vaccination. Is that a yes or a no? And we'll give you about 10, 15 more seconds or so as we see quite a few folks responding. And again, we thank you for your participation. All right, just about everyone has responded. All right, let's go ahead and close that out so we can move on to the next. All right, and this will be myth number 3, our final myth, and that is COVID-19 vaccines will affect my fertility. Is that a yes or a no? All right, once again, we'll give you just a few more seconds to participate in the poll. And once again, we thank you for being interactive with us. And this will close out in just a few seconds. All right, we have just about everybody who's responded. So we'll go ahead and close that out. And I'm gonna go ahead and hand it right back over to Dr. Tuckson for our panelists' introductions.
Well, thank you very much, Bridgette, and thank you so much, National President Jones and National First Vice President Miller for this opportunity. This is really an extraordinary pleasure to be your facilitator for these public education series of events and to bring the resources of the Black Coalition Against COVID to this partnership with you. Just to set the record straight, the Black Coalition Against COVID represents the combined medical professionalism and community-based experience of grassroots influencers in Washington, D.C., as well as the 4 Black medical schools, Howard, Meharry, Morehouse, and Drew, the National Medical Association, the National Black Nurses Association, the Urban League, and blackdoctor.org. We are gathering at this moment at a very important juncture in this pandemic's journey. To put our conversation in perspective, 500 people across this country died yesterday from COVID. 700 died on the 26th. 900 more died on the 24th, all adding to the total of well over 1 million people in this country who have died and now continue to die. And unfortunately, too many of them are people of color. We have suffered, and we still are suffering. And one of the major reasons for our excess suffering has been the combination of our hard-earned distrust of the institutions of our society, which too often bleeds over into a distrust of science and science-based health guidance by experts, a relative science illiteracy due to the woefully inadequate funding of our schools and high schools and junior high schools in our communities, combined with an increasingly complex science-based health era, where the new tools for genetic-based interventions are now becoming commonplace. And finally, we are suffering because we are living in a world dominated by social media's unprecedented capabilities to spread misinformation that seriously and increasingly threatens appropriate health decisions and behaviors by individuals, families, and communities. So I applaud NCBW for producing tonight's town hall, where we'll talk about the myths and facts of where we are in the pandemic. And now it is my pleasure to welcome our panel of trustworthy and knowledgeable experts who will educate us and provide science-based resources for us to use both tonight and following tonight. First, we have with us Dr. Deborah Howry. She is the acting principal deputy director of the CDC, and we're very, very pleased that she could join us with the wealth of experience and knowledge that she has. We're pleased to welcome a good friend of the Black Coalition Against COVID, Dr. Cameron Webb, who is at the White House COVID-19 response team and has been the driver behind almost all of the major initiatives in the Black community to fight this pandemic. We're glad that Celine Gounder, a physician and senior fellow and editor-at-large for public health at the KFF Kaiser Health News, extremely important organization that provides daily the facts and information that is so useful to making our own healthcare decisions about COVID. And finally, but not at all least, Dr. Melissa Clark of the BHE Group and one of the founders of the Black Coalition Against COVID. Well, to get us started, I want to turn to both Dr. Howry and Dr. Webb as we try to look at where are we now in this pandemic. And Dr. Howry, let's start with you. Can you describe for us where are we as a nation today in this pandemic? And as you describe that, we are hearing a lot about a word called endemic, and maybe you could bring that into your conversation as well.
Sure, great questions, and thanks for having me tonight. So the pandemic is not over, and we continue to have hundreds of deaths and thousands of hospitalizations a day from COVID-19, as you had noted. But fortunately, we're moving closer to a point where COVID-19 no longer severely disrupts our daily lives. It's important to note that where we are today is very different from where we were 2 years ago. So although COVID-19 continues to circulate, we now have vaccines, tests, and treatments that work. And most Americans have some immunity, either due to vaccination, past infection, or both. Several of the efforts funded by Congress will continue on as we strive to address issues of health equity, vaccination, and data modernization. And states and community groups such as yourselves will really continue to be partners in these efforts. So you asked about endemic. So we're pretty sure that COVID-19 is here to stay. And what we're seeing is that with the high levels of population immunity due to vaccination and previous infection, and the many tools we have to protect the general population and people at higher risk for severe illness and death, we now know that living with COVID-19 will really require us to use all we have learned from this. So stopping our hospitals from being overwhelmed and protecting society, and using things like our COVID-19 community levels and following labor prevention measures like staying up to date with vaccines and wearing a mask when recommended. I think each person has to look at what is the risk in the community, what is the risk to yourself based on your medical problems or issues and family members around you, and really use the data that you have to figure out how do you protect yourself at different points of this pandemic.
Outstanding. So this idea of having to learn to live with it, is this going to be the flu? I mean, what predictions can we make?
So I think with COVID, we've learned not to make predictions, because anytime we make a prediction, we're closing the gap or addressing knowledge differently. For me, I look at what's going on in the community. A couple of weeks ago, we were high in Atlanta. So I was wearing my mask pretty much everywhere, a good quality mask, certainly indoors, but, more so at a grocery store than I would when we're in low, and not in a crowded area. We're now at medium. When I'm in the office and just walking down the hall, I'm not wearing a mask. Again, if I'm out in a more crowded area or around people whose vaccination status I don't know, then I might be. So I think it's just really protecting yourself based on community levels and realizing when we get new boosters, you get a booster. You stay up to date on vaccinations as we have them.
Great. And Dr. Webb, let's take this more from a global perspective of where are we now in the pandemic, to the Black community specifically. Where are we in the midst of this pandemic at this moment?
Well, first off, it's great to be here with you all this evening. I think it's such an important time for this conversation when you say, where are we as a Black community in the midst of this pandemic? And there are a couple of reasons why. If you were to look at the data, we can go back to April of 2020, and we saw really tremendous rates of death in the Black community from COVID-19. It exacted a really tremendous toll on the Black community. We saw 70% of the deaths in Milwaukee were in the Black community, nearly 70% of the deaths in Louisiana, the state of Louisiana, were in the Black community, right? That was the early impact of the pandemic. And it's because it was built on top of all those structural inequalities, all that systemic inequality in our society that drives health outcomes, was driving deaths and driving hospitalization in this pandemic. And for that reason, groups like the National Coalition of 100 Black Women and others, Reed, your group, the Black Coalition Against COVID, so many said, we've got to do something to fight this fight. Communities came together and said, what can we do to protect ourselves, protect our communities? The first thing was, let's get folks tested. Getting information early on about having COVID made a huge difference. As time's gone on, you heard Dr. Horry say that there are a lot of tools that we have today, now that we're in August of 2022, that we just quite frankly didn't have 2 years ago. That would have saved millions of people right around the world, and certainly would have saved hundreds of thousands, if not more, lives in communities of color. And so when you look at those tools, you can tick them off really quickly. You can say it's the fact that we have masks, right? High quality masks that people can wear. You heard a reference to COVID community levels. That specifically tells people in your community, if you need to be wearing a mask, that makes a difference. The second thing is the tests, right? We had covidtest.gov, which, side note, it's closing on Friday this week. So go to covidtest.gov and order your test today if you haven't already. But having tests in your house so you can go to your bathroom and do a swab, and in 15 minutes, you know whether or not you have COVID, that has saved countless lives because people know early. And the power of knowing early is the third thing, the treatments that we have, right? Those therapies you can access within the first few days of your symptoms. That is truly saving lives. And then finally, you put that all together with the vaccination effort, all the community-based organizations, the faith-based organizations, the folks, the providers, the local trusted messengers who've gone out, and really communicated on a real level to change the game. I would say this. People ask me, where are we today in the Black community? I'll frame it like this. If you look at per million Black people right now, I would say it's about a little less than 2,000 cases in the Black community per week, per million people. It's about 122 hospitalizations, right, per million Black people, and it's about 2.7 deaths, right? And so when you see that difference, 1,700 cases, 122 hospitalizations, nearly 3 deaths every week from COVID-19 at this point in the pandemic, the first thing you should know is we can prevent those 122 hospitalizations. We can prevent those 3 deaths. And if it doesn't sound like a lot to you, I'm telling you, that's a lot of people when you add it up over the course of this pandemic. And so we're in a much better place. But we know that when there's a surge, when there's a spike, and I'll end here, Reed, because you can get me on a soapbox, I can keep going. But when there's a surge in cases, we know who gets hit the hardest. It's not because we're not thinking about communities of color. It's because every time this pandemic rears its head, it piggybacks on that structural inequality that we just haven't addressed in the United States of America. And so every time communities of color are going to get hit harder, that hard-earned vaccination effort that got us to equitable primary series vaccination rates by September of 2021, immunity wanes over time. You need those boosters, or else we're going to be right back where we were with excess deaths. I'll stop there, but I'll say we're in a much better place, but not out of the woods.
That is really, really important. And as I turn back to Dr. Howery, I want to be really clear that what Dr. Webb said in reminding us, we closed the gap in primary series vaccinations. That is an incredible accomplishments by our community. And again, organizations like NCBW need to take a lot of credit for that. So thank you. Dr. Howery, where do you see on the horizon in terms of new variants? We're hearing a lot about some new vaccines. What do you see sort of on the horizon on the causes and the prevention and treatment?
So a few things, and one, we expect, new COVID variants to occur. We constantly monitor them and work with our state and local public health officials to really monitor these variants, and detect them. Are they more severe? Do they cause different illness? What's the transmission like? Something I think is really exciting that we're partnering with Ginkgo Bioworks and Express Spa on a traveler-based genomic surveillance program. And this began about a year ago, but we announced that we're going to continue to work on it. And it collects nasal swabs from arriving international air travelers from select countries. And this really helps us overcome gaps, as we know many people are starting to do self-tests, or other countries are decreasing or discontinuing testing and sequencing. When people do these tests in airports, we're then able to do the sequencing and detect these new variants still. It's in 4 cities currently, and we'll be adding a 5th. It's in New York, Newark, San Fran, and here in Atlanta. I saw it when I was coming out of the airport myself a few weeks ago, and it'll soon be expanding to DC. You asked about vaccines, and this week, literally Thursday and Friday, our advisory committee on immunization practices is set to meet to discuss the COVID-19 boosters. And this committee has met more than 24 times since the COVID-19 vaccines became available. And they will be reviewing things like the bivalent booster shot to really review the science and make recommendations for their use. And then
Dr. Howery, could you, by the way, as you lay that out, could you explain what bivalent means? Because I think a lot of us will not understand.
Sure. and what I'd say about this one too is this one is looking at some of the newer variants. So the first ones we had were based on what we knew of the COVID virus. This one is looking at some of the strains, more of the recent ones. I believe it's BA2 through 4. Dr. Webb or Yonder can probably update that. And this one will allow us to have greater protection around the more recent variants that are out there. You still want to have that primary series, but this booster, it's like the flu shot. Each year you update the flu shot to address the newest strains that are out there. And that's what this booster will do as well, assuming that after it's been reviewed by the CDC committee and they look at the safety and the data, that then it'll be available.
Well, listen, let's just stay on that. Oh, great. I'm sorry, Cam.
Yeah, I was just going to jump in there. I think that's a key point, right? If you look at the damage that this Omicron variant has done, particularly in the Black community, right? The surge in cases that we saw at the beginning of 2022, right? It started first detected right around Thanksgiving last year. Omicron has been the biggest player in this game since Thanksgiving of last year. And it's not letting up. There were several different versions of Omicron that have just hit wave after wave after wave over the last year. And so with the thought process here, this is the fruits of the labor of having these messenger RNA vaccines that we have, Moderna and Pfizer, is that you can then update them with the newest variants. You can say this is BA4 and BA5. They're making up the lion's share of cases that we see. We're going to make sure that as we give people boosters, boosters don't last forever, but they can last you through the next stretch of the pandemic, and it's going to prepare and train people to detect Omicron specifically. Or to fight or protect against Omicron specifically. That's going to make a big difference and be a big deal. So those are going to hopefully, CDC's committee is meeting later this week. I'm not going to get ahead of them. We got to let the science do its thing. But once these become available, I think it has the potential to be a real big boost, especially as we head into the holiday season. We know what happens every year when people start traveling, when the weather gets colder, when flu season heats up. You got to have that flu shot. You got to have up-to-date vaccination. This is going to be a big part of that.
Well, I
And
would
think
say
all of us sharing too about getting our vaccines is really important, because I think people always wonder about the safety of vaccines. And so, I've got a teenage daughter, and I told everybody, we were first in line when her age group, came eligible. I think the more we share, particularly like this panel, as clinicians and scientists, we believe in the data, we believe in the science. We're doing it for ourselves and our family members. And as you and I were talking about, Dr. Tuckson, having this group as really trusted messengers and this coalition, that's what it's going to take to close the gap and make sure that we are focusing on preventing a lot of these COVID illnesses.
Well, I will tell you, if when that new vaccine is approved, and hopefully it'll be approved, and hopefully it'll be approved around Labor Day, I think you can count on NCBW, Black Coalition Against COVID, all of us to be part of the Army to try to make sure that we are as successful in getting compliance with these vaccines as we did with the primary series. Before I let you go, Dr. Howry, I want to make sure that we are clear about the CDC and it's how it creates its evidence and why it is so trustworthy. I just want to say to you that of course in the news we hear a lot of people who are disaffected about various things about the CDC, and there's always going to be controversy in public health anyway. But I know that I rely very heavily on the CDC's website and its process. But can you give the audience a little bit of a sense? I know you changed your guidance recently. Why did you change the guidance, and what's the kind of process that leads to those changes?
So great question. And I think the COVID pandemic has really taught us a lot about learning about science, and viruses and these changes. With CDC, with our guidance, anytime we start seeing changes in data or trends, we reassess. So similar, like when we first learned about asymptomatic spread, we updated our guidance accordingly. Right now, as we realize that people are in a different place based on being immunized, some of the levels of infection in communities. And like Dr. Webb said, now that we've got treatments, that allows us to address infections in a different manner so that, when you are infected, wearing that mask, considering a test at day 5, certainly continuing to wear that mask through day 10. And we know now that, unless you're in a very populated area, like a congregate setting, we don't recommend screening tests as much anymore, given where we are in the pandemic. So anytime we see new data, how it's impacting people, that's when we reassess the data and issue new guidance. And it's something we'll continue to do, like we're doing with monkeypox now as well. As we get new information, we update our guidance.
One thing, and I'll get, before we let you go, and also I asked Dr. Webb for his thought. We in the Black community are often concerned and have distrust about the mechanisms of government. We wonder whether or not we are involved in the process. Can you talk about whether or not physicians of color are involved in making the decisions? And then I'll ask Dr. Webb for his perspective.
Very much so. We've partnered with many different medical organizations as well, worked with clinicians. And I think also just looking at communities and how they're impacted, we very much understand we need diversity of partners, patients, and providers. And this has been a very inclusive process, and one that, again, as we have different evidence, we share it with our communities and try to do our best to decrease these disparities and really dispel these myths.
Great. Dr. Webb?
That distrust, you said this earlier, Reed, but people got that honest, right? I mean, past is present to communities of color. And so, I live in Charlottesville, Virginia, and long before it was known for the Unite the Right rally, it was known for a lot of residential segregation here in Charlottesville, Virginia, to the point that, there are folks who are seniors in our community now who won't go to the hospital because of the segregated wards in 1963, right? And the same is true when we think about government. So people have had really bad experiences with government leaving out communities of color, particularly the Black community, or designing policies specifically that harmed communities of color. It's the same entity. It's the same structure. It's the same mechanism. So when you hear your grandma, your grandpa, your uncle, your aunt talking about it, it's the same entity. The difference is who's got the keys. And I think that this is what's different about this moment. If you look at who's driving a lot of the policy, if you look at who's really the loudest voices in the room, you listen to the way that we talk about centering equity in our decision making. We always say that's a new muscle for government. That's not what government was designed to do early on, or even in the last 20 years. That's something that we've grown to realize how critically important that is. Our communities have known it forever. But I think that this is a different moment. In this pandemic, we've made a point of it to really lean into the fact that we've got folks in positions. I mean, the fact that my job exists, right? As a senior advisor in the White House who's leading equity work, they pay me a whole salary to make sure we're looking out for communities of color. And so that's not something we've done in the past, but it's what we're doing now.
Well, and finally, Dr. Howery, I would just say that I would hope that, and knowing your values and those of the current CDC leader, that more Black women physicians and scientists would have an opportunity to be promoted, to be in positions of authority, and then can again speak back to our community with confidence and trustworthiness. As we finish this section, I use the CDC website. Is this a website? I mean, I'm a physician, so I'm used to using it. Is the CDC website accessible and easy to understand for the American people?
So we're working on it. I would love to say 100%, but we're doing our best to really use plain language. And that's one of the things that Dr. Walensky has talked about, is making sure it's understandable and that you can navigate it. So we have patient pages, much more simplified now with links to get more resources, good search engines to really help with it. Certainly we continue to want to improve and to focus on this, but it's chock full of information, probably if anything, too much information. And that's what I would say is what makes it difficult to navigate. But I just looked at the recent guidance again today on the website, and it's much more digestible and easy to understand and updated continuously. So you can always find the latest information.
I would urge our audience, if you hear some nonsense on social media, go to the CDC website, please. And just CDC, that website address again is?
cdc.gov.
I mean, can't be too hard to find. So let's do that. Dr. Howery, thank you so much. Dr. Webb, if you could stay a bit, we appreciate your being here and your leadership. And as I turn now to the next section of the program, I'm going to give fair warning to Dr. Clark. There are two very good questions, Dr. Clark, in the chat, which I will be coming to you to address in a moment. We appreciate these questions from our wonderful audience. But now it's my pleasure to introduce Dr. Celine Gounder. Celine, you and your colleagues at KFF have been tracking the public's attitudes regarding misinformation for a while now. And I know that you are an expert in public health. You are an outstanding physician, but you also are really an expert on communicating trustworthy information to the public. What has KFF been seeing regarding the public's attitudes around misinformation?
Reed, thank you for having me join all of you today. I think the number one area where we've seen mis and disinformation around COVID vaccines that is of particular importance to the Black community is around pregnancy. So just to put this in context, Black women have 3 times the mortality rate related to pregnancy as white women in this country. So they're 3 times as likely to die from causes related to pregnancy than white women. And we know that COVID, like influenza, like a number of other conditions, is more likely to cause complications in pregnancy, to cause the death of a woman in pregnancy, to cause miscarriages and stillbirths. And so it's really important in that population to be vaccinating against COVID, against the flu. And yet, this is one of the areas where we've seen the most disinformation spreading is about the safety of COVID vaccines in pregnancy. And to be very clear, COVID vaccines are very safe and effective in pregnant women. We've also seen a benefit to newborns, to young infants, in terms of the antibodies that are transmitted from a woman through the placenta during the pregnancy, as well as through breast milk after the birth. And so this is one of the most important things a woman can do to protect herself and her child during the course of pregnancy and afterwards. So, I think this is one area, unfortunately, there has been a tremendous amount of mis and disinformation, and yet is one of the most important things that really pertains to Black women, Black health in the context of COVID. Some of the other areas where we've seen real issues with mis and disinformation relate to where people get their news. We track the big networks, so to speak, and what we are seeing is that the major networks that are associated with mis and disinformation. So in other words, if people get their news there, they are more likely to believe in myths about COVID and COVID vaccines. The top three, and this may not be surprising, are Fox News, One America News, and Newsmax, whereas people who tend to get their information and trust the big networks, so ABC, NBC, CBS, or local news, or CNN, MSNBC, or NPR, tend to have more accurate understandings of COVID and COVID vaccines. And then finally, the other disparities I'll highlight in terms of myths and belief in mis and disinformation is really geographic as well as partisan. So geographic in that rural Americans do tend, for various reasons, to more strongly believe in myths about COVID. We do see a right versus left-wing partisan divide, with right-wing partisans buying more into mis and disinformation. And younger Americans and Americans who get their news on social media also more likely to buy into mis and disinformation around COVID.
Boy, Dr. Clark, I think one of the things that scares me about that and all these people that are getting this information from these unreliable places is that I meet them in the grocery store, in the airport, in the restaurant, that it's not as if they live in a different world than we do. Dr. Clark, you have been looking, and in fact, every week on your podcast, which you might want to give the name of in a second, but every week you have a special section that caught my attention, which is debunking myths. What are you? What's the biggest impression that you have of this challenge?
Well, first of all, let me say I'm delighted to be here tonight and join the other esteemed panelists. As far as what I'm hearing, it's kind of more like, what haven't I heard in the last 2 years? It's everything from vaccinations have microchips, of course. We've heard about concerns regarding vaccinations and fertility. I've even heard that vaccines might mess with my street drugs, and so I don't want to take them, or vaccines are actually what caused COVID. On the show, which is called Excuse Me, Doctor, we have done over 100 separate debunk segments, and we've actually even produced numerous short PSAs, which have aired throughout the state of Georgia, especially in rural areas, around themes like fertility and COVID, how COVID is spread, who's at the highest risk. And those PSAs can be found at vaxnowga.org. I started Excuse Me, Doctor, at the beginning of the pandemic as a way really to empower the listening audience. I was getting lots of questions as a physician and thought that it was really important to get the accurate and science-based information out in light of all the misleading information and politicization of the pandemic that was going on. And so the show itself, and as I mentioned, we've done over 100 episodes. It's on Facebook, YouTube, and soon to be on SiriusXM. It gives listeners this evidence-based health information that's, I specifically say, not based on stories and not based on speculation. And one thing we know about pandemics is that they're often accompanied by misinformation pandemics, right? We know that misinformation thrives in times of uncertainty, when people are the most afraid and they're seeking answers and the situation is evolving. And so they want something to grab onto. And so they want that certainty and reassurance that they're looking for, even if it's dangerous, like drinking bleach, or unproven, like avoiding vaccination. So you already ran down why, how this is different from the 1918 flu pandemic, right? Because now we have social media. Now there's more politicization of the pandemic. And then, of course, the targeting of communities with misinformation, communities that are already mistrustful, have been victims of systemic racism and disenfranchisement, and who've often had lived experiences in the healthcare system that reinforce that. And so it becomes a fertile ground for the seeds of misinformation to just take off and grow like weeds.
Sure.
So through my show, but also working with organizations like Black Coalition Against COVID, DC Department of Health, for example, Leadership Council for Healthy Communities, and others, we've been really working to exert an equal and opposite intentional full court press against misinformation that not only seeks to debunk it, but also to really heal those wounds of mistrust that our communities have had, and also empower communities with the facts to make the best healthcare decisions for themselves, their families, and for the community.
Let me turn to Cam, you, and then back to Celine. How do you advise our audience to navigate their way through this complex world of swirling and dueling information?
Yeah, the infodemic, if you will, right? The first thing before I jump in, I have to double click on Dr. Clark saying, "Excuse me, doctor, soon to be on Sirius XM." I mean, that snaps right here. That's big stuff. And,
Thank you.
And I'm glad that we're gonna have that voice in that space. That's part of what we need to do, right? Creating spaces that are trusted, creating spaces that are factual, that can counteract all of the dueling information that's out there. That's the key. What we're asking people to do with no preparation, there was no lead time into COVID-19. We're asking people to sort through complicated scientific information to make important life decisions, right? And I think this is where that notion of local trusted messengers is the key. And everybody has somebody in their community, in their family, in their world who they can look to and ask questions and expect a truthful, factual answer. And the key is finding out who those persons are in your life. Right? We direct folks to their primary care providers or their nurse practitioners or their PAs or the public health folks in their community, but really hoping that folks are turning to those trusted, health professionals in their community. That's going to make a huge difference. The spaces where you have good information, that makes a huge difference. But it really is, just realigning people's expectations of where you get information, because it ain't Facebook, it's not Twitter, right? I mean, there is good information on those spaces, but it's become so hard to sort between what's real and what's not, that I think that for these big decisions, people need to go to the folks they trust.
And come back to the NCBW series of health educations now and those in the future, which is definitely there. Celine, how do you answer this question?
One of the things I've learned over time, and I've worked in a lot of different epidemics now in different parts of the world, Ebola in West Africa, polio in Pakistan, COVID here in the US, monkeypox now in the US. A lot of the mis and disinformation that people latch onto, it's less about the facts or non-facts per se. A lot of times it's about why it's an expression of their lack of trust. And so I'll give you an example. In West Africa, you have a lot of Westerners that come in, you have mining companies, people are exploited, the land is exploited, it's extractive industries. And people have very good reason not to trust. In Pakistan and Afghanistan, you've had literally the CIA using a hepatitis B vaccination campaign to take blood to track down Osama bin Laden and his family. And so people have real experiences. This is not rooted in imagination or myth. It is rooted in true experience that then drives a lack of trust. And so what I find is getting to that root, trying to understand, why don't you trust? And that does require asking a lot of questions, being patient, listening, and it may not feel like it's directly relevant to getting somebody the COVID vaccine, but it in fact is, because in understanding why they don't trust, why they're questioning, why they are fighting back against the system, once you understand that, it's a whole lot easier to get somebody to trust.
Good for you. And we just cannot let the distrust of our own health professionals and whatever lead us down a road where we don't take good advice and we kill ourselves because of it. That's important. Well, now we're going to take the challenge panel of answering some of these questions. We're going to go really lightning fast. And bravery is rewarded. So is it true that the PCR test is better than the home rapid test? And if so, why?
No, they test for different things. So the PCR test is testing for the viral genetic material. The at-home test is testing for the protein. So the at-home test is really the better test if you want to know, am I infectious? Am I a danger to other people? And I think for most people who are getting a test, that's actually the answer you want to know. You want to know, can I send my child to school? Can I go to work? Can I go out to that restaurant or that bridal shower? And so really, there is nothing wrong with the at-home antigen tests. It really is a question of what is it that you're trying to answer?
Good. And by the way, Cam Webb mentioned earlier that, again, the federal money has run out because the Congress, and we know who the people responsible for this is, has not allocated the money for continuing to buy those tests for free for the public. And so we in the Black community, as always, we're going to take care of ourselves. So if we know of people in your community who do not have the resources to get their own tests from the drugstore, please, let's all pitch in. I mean, this is just about saving our lives together, not just the individual alone. Dr. Webb, there's a question that says, what's the time frame for the new vaccine? And we sort of touched on it earlier, but what's your answer?
Yeah, so in the next couple of days, we'll have kind of the scientific decisions from CDC's committee. And probably, if everything goes as we're expecting and if it's moved forward, then early next week it'll be available in your communities. And we are asking all the states right now to pre-order vaccines. So as soon as FDA, authorizes it, we're going to start shipping that into communities before the end of this week. If that happens tomorrow, as we expect, and right after Labor Day, folks should be able to get that booster. Remember, this is a booster. So if you haven't gotten any vaccines yet, you still need to get the primary series. And we expect what FDA is going to say is that's going to be with the original vaccines, but that booster is going to be with this updated or Omicron-specific booster. And again, can do that as early as next week.
Dr. Clark, I've had 2 boosters. I will get my annual flu shot in September. Will I also need a 3rd booster when it comes out?
Well, it's possible, and it depends who you are. So we have to see are they talking about the Omicron specific booster that Dr. Webb just talked about, or are they talking about yet another booster for COVID-19 that's not that? If you've already had the primary series and you've had both boosters, you're as up to date as you possibly can be. And so we have to see what the guidelines will be around the next Omicron specific bivalent vaccination that Dr. Webb spoke about, when it will be available, and then decide if that is for you at that time. But if you've already had 2 boosters, you're as up to date as you can be right now.
Great, thank you. Celine, shouldn't schools mandate testing and masking where vax rates are low?
Yeah, so this is a really tough question because this is not just about science. This is also about social, cultural, political concerns, and different schools, different communities are going to balance those priorities differently. What I would say is, you as a parent, you have control over your child, I guess, to some degree. And, you can counsel your child if you feel strongly about it, to wear a mask, to continue wearing a mask. And if you do counsel your child accordingly, to wear either an N95 or KN95 mask, those are the high quality masks. I have had some friends who have children who have various disabilities, immunocompromising conditions, who've asked me for their advice. they have said, well, none of their friends are masking. What should I do? And, if there are limits to what you can enforce with a child at school, particularly if the school's not enforcing those, requirements. But if you are concerned, I would strongly, counsel your child to wear the mask.
Well, a related question, Dr. Webb, and I don't know if you have an opinion on this. Can people who have been vaccinated and or boosted without symptoms unknowingly pass COVID to someone else?
Absolutely. The thing about the vaccines that we've seen is that people can still get COVID infections. And shortly after your booster, you have your highest levels of what we call circulating neutralizing antibodies. And so that's kind of your first line of defense. Comes in contact with the vaccine, it can really help keep it at bay. But after some time, you don't have those neutralizing antibodies in as a rich supply. You still have immunity. So your immune response will still be there to protect you against severe disease, hospitalization, and death, but you may still have an infection. A lot of infections are asymptomatic. And since we're no longer doing just screening testing more broadly, it's very possible. That's the reason why people still need to use some level of caution. You heard mentioned earlier the COVID community levels. That's an important tool. Knowing what COVID is doing in your community helps you make good decisions. So know that you can still pass it to other people. And if they're not as protected as you are, it can be really damaging to their health.
But Dr. Webb, this is a really important point, though, and I want to make sure that we just spend another minute on this. We know that people are testing so much more at home now, and so they're not reporting it. And so it seems like now we're at a place where the home testing has been so successful that we don't have a good picture of what is the community spread. So can we rely upon looking at our local public health department data about community spread, or do we just need to now just assume that it is widely prevalent?
Well, that's the reason for the shift to COVID community levels to some extent. It focuses on hospitalization. So, you have a similar number of cases and they all lead, a same subset of cases lead to a certain number of hospitalizations. It does give you a sense of spread. And so I think that's part of it, but it is hard. We've lost sight on exactly how many cases there are for COVID-19. We never really had full visibility. In some of the hardest hit communities, they never had access to testing in the first place. And when you mention, I just have to flag here, we talk about at-home testing being widely available. The Black community is the least likely to use at-home tests. If you look at the data, we use these tests less than everybody. And even though 87% of the population has insurance, and your insurance provider is required to give you 8 tests per month at home for free, we're not seeing the full uptake of that because some of the design was to make you pay for it up front and get reimbursed. So the key is we have a lot of tools for folks to get tested. We still need to drive that case forward and say, hey, this is going to be a key part of it, because even though you may be asymptomatic, other folks in your family or your community may not. Testing is a part of the mitigation strategy.
And I also want to add to that wastewater testing is still happening in many municipalities, and that's also a way to indirectly understand where the prevalence of COVID is in your community if you're really looking for those kinds of answers, because that testing data isn't available as much anymore because people are home testing. And I just wanted to mention one other thing about the home test. When you're deciding whether you're infectious or not, to go to a function, for example, if you know that you've been exposed, it's important to test for several days, because just because you test negative on day 3 after exposure, you might test positive on a home test day 4 after exposure. So the responsible thing to do is, if you know that you have been exposed to someone, to test serially, not just one time.
And I would really urge everyone on this point. The simplest, best way to know what to do is go to the cdc.gov, or you can go into Google and just put in Google, I have been exposed to COVID. What do I do? And it'll take you right there. It'll explain what do you do, how long you need to isolate if you need to. Everything you need to know is right there. It's as simple as pie. So just put that into your system. By the way, in the chat, I noticed that someone has put in where you can go to by Friday to order those home tests. Dr. Webb is saying we ain't using them enough. Let's mobilize and get that done. Dr. Gounder, there is a big issue here about long-term effects on COVID, long COVID. We only have a few minutes, but Can COVID infection cause long-term effects such as asthma, narcolepsy, or sleep apnea?
Well, we know long COVID can include symptoms affecting the neurologic system. So that would include the brain. So there's a symptom of brain fog, not thinking clearly, having difficulty with memory. Long COVID can also include issues with the lungs where you don't breathe as well. You might get short of breath really easily, not be able to exercise the way you used to. We've also seen issues with heart function. This has included irregular heartbeats, racing heartbeats, in some cases heart failure. So there are a number of different symptoms, syndromes that we think are associated with having had a COVID infection. The problem is that what we call long COVID right now is probably a catch bag of a number of different syndromes, and we have to do a better job of teasing those apart so that we better understand what is causing each of those syndromes and how best to treat them, because it's very unlikely that the treatment for one subset of long COVID is necessarily going to work for another.
I really want people to be attentive to this long COVID issue. It's estimated now that maybe 1 out of 5 people with COVID are going to have some of these very difficult to categorize symptoms: fatigue, brain fog. There can be challenges with your heart, with palpitations, and other kinds of things across the body's various systems. This is important, and when people are becoming ill long term, it affects their employment, it affects their health costs, because you have to pay, of course, to go to the doctor to get these things evaluated. This is potentially a very, very major storm cloud over our heads. And so, of course, the best thing is not to get it. Very quickly, Dr. Clark, one of the questions about not getting it, someone is very interested in what we might do other than vaccines to boost up our immune system and to help us to get through this. I would hope that the questioner is not suggesting, as too many people do on these kinds of conversations, that there is a trade-off, that you can do other things other than getting vaccinated. Let us be very clear. You've got to get vaccinated. Now, Dr. Clark, are there other things we could be doing?
So there are only 2 ways to develop immunity against COVID-19. One is to get vaccinated, and the other is to get COVID. And by far the safest course of action is to get vaccinated. That's what builds your immunity. Your overall health ensures that your immune system responds well to the vaccine and produces the antibodies and the memory cells that are necessary to sustain your body's immune response against COVID. So what are some of the things that improve your overall health? Getting enough sleep every night, making sure that you move every day, eating a nutritious diet that's mainly plant-based, and getting enough water, and then finally managing the stress in your life, because stress pulls energy away from your immune system. And so if you have developed practices for yourself every day in terms of managing your stress and keeping those stress hormones down, those are the best things that you can do to maintain your overall health and ensure that you have a great sustained immune response when you get vaccinated or if you're exposed to COVID.
Well, we'll have to leave it there. Let me just quickly mention the poll, and thank you all for participating. And I think that you should have learned now that the ingredients in COVID-19 vaccines are not dangerous. These are very, very common elements found in so many other things that we put into our bodies. And the best proof of all, of course, is after having billions of people receiving shots around the world, none of the nonsense that people have been promulgating on all kinds of social media chats, growing 3 arms and a 4th nose, none of that occurred. And so the proof has been in the pudding. And what more do you need than billions of people having already received this? Number 2, that the natural immunity that you get from being sick, while it certainly does purvey some protection, it is not enough to say to you, you should not be vaccinated. You need to be vaccinated. And finally, we have learned unequivocally that vaccines do not affect the fertility of either the woman or the man. And so we are very pleased with that. I want to thank our guests tonight for this, and to NCBW for their continuing leadership. I think we know that Black women make about 70% of all the health decisions in the family. And so you have a lot that you are carrying on your shoulders. Thank you, Black women, for what you do for yourselves, for your families. But I want to thank you for what you do for the Black community. We love you, we care about you, and let's keep pushing forward to save Black life. Thanks to our guests so much, and I turn it back now to First Vice President Miller.
Okay. Thank you, Dr. Tuckson, for serving as our moderator, and a special thanks to our panelists, Dr. Lowry, Dr. Webb, Dr. Gounder, and Dr. Clark for providing that much needed information on myths and facts of where we are in the pandemic. We would also like to thank our sponsors, the United States Department of Health and Human Services, the Black Coalition Against COVID, Walgreens, and the Black Women's Agenda Incorporated. A special thanks to our national president, Elizabeth A. Jones, National Directorate, our staff, National Health Committee, and our producer, Bridgette Baker. We want to hear from you, so please take a few moments to complete a quick survey about tonight's webinar. You can either scan the QR code on the screen or use the link that we dropped in the chat. Your feedback helps us to continue bringing programming like this one to our communities. We appreciate each of you participating this evening and believe that you are better informed on myths and facts of where we are in the pandemic. We invite you to register and participate in our additional webinars. Enjoy your evening.